Hi. I guess we'll get started. Sorry. Um, so I have my patient. I'm in the med room right now. I'll just give you a quick history of my patient. I have Clarence Ripley, 76-year-old male, who was brought to the ED with inner ear pain and dizziness for 5 days. He's had frequent falls at home, his wife has reported. He's being admitted to the med surge unit. He's being started on afloxacin for his eardrops, BID. Um, he'll be evaluated and worked up by physical therapy for his falls. His wife let us know that he takes Xylantin and for the glaucoma in his left eye and Flonase for his allergies. The doctor has prescribed those to be given while he's here. The patient also let us know he hasn't had a BM or bowel movement in 4 days, so he's requesting a suppository. The doctor has added Docalax for his night meds tonight. So I'm going to start in the med room by comparing the MAR. I'm going to look at the MAR versus the doctor's medical orders and make sure those match up. So I'm going to make sure patient's name is correct, first and last name, patient's date of birth, the ordering doctor, and then I'm going to look at both med orders, the MAR and the doctor's orders. So I'm going to look at the ofloxacin. It's the eardrops, dose 10 drops each by ear BID. That's what the doctor has ordered. We're going to look at Flonase nasal spray, 50 mics per one spray, 50 mics per one spray, dose one spray each Nair BID, dose one spray, so that matches as well. The Xylantin, 50 mics per 1 ml dose, one drop left eye each night. So let's look at that. Dose one drop in left eye each night, 50 mics per 1 ml, perfect. And then the Docalax, 10 milligrams suppository per rectum for one night, 10 milligrams suppository for one night. So that all matches. I'm going to also look at the patient's allergy meds, just double check everything is okay. After I've confirmed that the MAR matches, at that point I'm going to do my first med check. And I'm going to do the 6 rights. So I'm going to make sure it's the right patient, verify name and date of birth. I can even use the MedRec number. Never use a room number or just one identifier. Always use two. So I always stick with name and date of birth because that will never change. Um, well, not normally. Right drug. I'm going to make sure what I'm pulling out of the Pyxis is going to be the right drug. People make mistakes. There are humans that are stocking this. Also, the computer can glitch, tell me the wrong drawer. So whatever I'm pulling out of that drawer, I want to make sure is matching to a T my orders. I want to make sure it's the right dose, that we're not overdosing or underdosing the patient. I'm going to make sure it's the right time. Usually we have a little bit of a leeway. It kind of depends on the facility, but looks like usually anywhere from 30 minutes to an hour before and after is what's normal. Um, but I just want to make sure it's the right time, the right route. I want to make sure, however the doctor has ordered the eardrops, I want to make sure they're eardrops. It's not an oral med. We just want to double check that. And then I want to document because if you didn't document it, it didn't happen. So once I've done my meds, I make sure every single med that I've taken out matches the MAR and the physician's orders to a T. Then I'm going to gather everything up. While I'm in the med room, I'm going to refer to my F.A. Davis book and just educate myself on each of the meds, their classes, the contraindications, and also the side effects. I want to be able to explain that to my patient, but also for side effects, I want to know what to be looking for in my patient, just in case there are some side effects he's experiencing. So once I have educated myself, I'm going to take everything into the patient's room. I would knock on the door. As I'm walking in, I'm going to do hand hygiene and I'm going to introduce myself. Hi, my name is Kayla. I'm your nurse today. Um, can I get your name and date of birth? And Mr. Ripley will tell me his name, his Clarence Ripley, but they call him Rip, and his date of birth is 12/18/43. Hi, Mr. Ripley. I just wanted to come in. We're going to give you some meds today. We have 4 medications that we're going to be giving you. I'm going to just double check everything and then We're going to go over some teaching on each med, and then we are going to do a couple assessments on you for those meds. So I'm going to set them to the side. So once I've explained what I'm going to be doing, I'm going to do my second med check again, make sure each med is correct, make sure name and date of birth match all the orders, make sure the dose is correct. Again, my 6 rights for my med check. Once I have done my second med check, I'm going to provide the patient privacy, either ask whoever's in the room to step out for a few minutes or ask him if it's okay if whoever's in the room is in the room while we give him this. We are going to be giving him a suppository, so I'm assuming he does want some bit of privacy. I'm going to pull the curtain. I'm going to make sure his call light is near, his bed breaks are on, and he's comfortable as he can get. Once I've done that, my second med check, and I've made sure he has privacy, I'm going to be explaining each med. So, Mr. Ripley, I'm going to go over some of the meds that we're going to be giving you before we do anything, and then we're going to do some assessments on you, okay? So the first one we're going to be giving you is the ofloxacin, and that's for the bacterial infection in your ear, okay? It's a fluoroquinolins. Um, do you know if you have any renal issues? He's gonna say no. Prior to me doing this, I have checked his BUN and creatinine, and it was normal. Um, this can also cause some breathing issues, a rash, depression, fatigue. So if you experience any of those, I want you to let me know, okay? The second medication we're going to be giving you is the Dulcolax. It's a suppository to help with a bowel movement. You had told the doctor that you haven't had one in the past few days. So we're going to help you with that. This is a laxative, and the side effect could be stomach cramping. The third one is Dilantin. That's the eye drops for your glaucoma in your left eye. You take that at home. That classification is a prostaglandin. It can cause ear irritation, eyelash growth, and iris darkening. The fourth med that we're going to be giving you is Flonase. It's a nasal spray to help with the inflammation in your sinus cavities. You take this one at home as well. It's a corticoid steroid allergy medication. Some of the side effects are breathing issues, anaphylaxis, and angioedema. So if you start to have any breathing issues, your throat feels like it's getting a little tight, you need to let me know immediately, okay? So once we've done the teaching, I am going to do my third med check. So I am going to again make sure every single thing matches. Make sure the dose, the time, the route, the name, the drug is all correct. Just make sure every single thing is correct. So now that I have done my third med check, I'm going to take everything to the bed. I'm going to put some gloves on, and I'm going to do an assessment on him before I administer each medication. So the first one we're going to give you is your Xylantin for your glaucoma. So what I'm going to do is I'm going to examine his eye. I'm going to ask him first if he's had any blurry vision. Does he have any pain, discomfort, itchiness? He does take this prior, so I'm going to ask kind of how he responds to it at home. If he has any side effects that he notices at home when he takes this. When I ask about his vision, I'm going to ask, is there a time of day that your vision is worse or better, day, night, So once I've done that, I'm going to take my light. I'm going to shine it in both eyes. I'm going to pull down and just look underneath. I'm looking for redness, swelling, drainage, crustiness in his eye. Is it pink? Is it yellow? I'm just going to examine the eye and the sclera. Um, at that point, I'm going to let him know. I'm going to let him know. I'm going to administer these drops in your eye. Once I put these in, I'm going to have you push on your lateral duct right after for about 30 seconds to make sure those drops don't get stuck down in there, okay? And then I'm just going to make sure he understands. So again, I have gloves on. I'm going to pull down on his eye, on his left eye. I'm gonna have him lean back slightly, and I'm gonna put one drop in the bottom of the sclera. If and then once I'm done, I'm gonna have him push on his lateral duct for 30 seconds. After that, I'm just gonna ask how he feels. Is he okay? Once he states he's okay, then we're gonna move on to the second one. This is the otic for his ears, the ofloxacin. I'm going to examine his ear for tenderness. I'm gonna pull up and look down in his ear for tenderness, drainage, redness. I'm gonna ask him, how long have you been having this earache? Do you have any ear ringing? Um, any other discomfort? Once we've went over all of that and we've looked in both ears and just made sure everything is okay, I'm gonna make sure it's clear. I don't really want to stick anything in his ear, but I just want to make sure it's clear before I administer the meds. I have a cotton ball. Again, I've already administered for blockage. I'm going to turn slightly to the opposite side, lay him back, pull back and up on his ear, and administer 10 drops in each ear. When I administer the drops on this side, I'm going to take the cotton ball and slowly massage it into the ear and just leave it there for about 15 to 20 minutes. The cotton ball will stay there. I'm going to have him stay on this side for about 5 minutes. Once it's been 5 minutes, we'll switch him to the other side and do the same exact thing. And then he'll just need to leave the cotton balls in for about 15-20 minutes. Um, which I could probably, no, I wouldn't start with that because then he probably couldn't hear me. Sorry. Um, The third one is the Flonase. So this one is the one for your allergies. You take this at home. Do you ever experience any breathing issues or anything like that with that? He's gonna say no. So I'm gonna just look at your sinuses. I'm gonna palpate his sinuses and go all the way up into kind of his T area, as I call it. I'm gonna use the light and examine his nasal canal, look for redness, drainage. Does this hurt anywhere that I'm pushing? Do you have any pain or discomfort in this area? Once we've went over that, I'm gonna have him blow his nose, kind of cough up whatever phlegm he has. I'm gonna let him know once I spray this in his nose, he cannot blow his nose for at least 5 to 10 minutes after. Once we've went over that, I'm gonna have do one spray in each nose or in each nair and just have him, when I spray it or if he wants to do it, take a deep breath in as he does it, kind of a deep whiff, as you could say. And then again, I'm just going to really emphasize, do not blow your nose for at least 5 minutes, okay? Um, Once we've done that and he's comfortable to move on to the next med, we're going to go with the Dulcolax. This is our last one, okay? The Dulcolax is going to be for your constipation. You might experience some stomach cramping. You just got to let me know how you feel about it, okay? And then once we're done, I'm going to have to lay in a flat position for about 5 to 10 minutes, just for this to work. Once it's been a few minutes, then I'll lay you back up to where you're comfortable, okay? So I'm going to turn him on his left side, left, and put him in a left lateral position with my gloves on. I'm going to put some lube on my finger. I'm going to explain to him he may feel a little bit of pressure while he's on his side. I'm just going to kind of do a skin assessment and check his back and just his back, his bottom, the back of his legs. This is a really good time to do your skin assessment. I'm going to inspect the area for any bleeding or hemorrhoids. I'm going to ask him while I do this to take a deep breath in, and then I'm going to gently push it in with the rounded side first, hold it in for just a second or two, and then pull my hand out. I'm going to keep him I'm going to keep him on that side for just a minute or so, and then I'm going to put him in a flat position and just remove my gloves, wash my hands while I'm in there. Um, oh, I would have inspected his abdomen first. I'm going to do a full abdominal assessment. First, I'm going to listen to his stomach. Well, aside from inspecting it, I'm going to check for any distension, hernias, anything like that. And then I'm going to oscillate in all four quadrants for bowel sounds, for at least a minute or so in each area. Then I'm going to percuss in a zigzag form, 3 areas each in all 4 quadrants. Once I've done that, I'm going to do some light palpitation again in all 4 quadrants. I'm going to also ask him how often does he normally have bowel movements? Is this common for him to be constipated? And so forth. Again, I would have done all that before my medication. Um, Once he's had the meds, I'm going to put him again in the flat position. I'm going to make sure his bed rails are up, his bed is green, his bed light is green, his call light is in place. I'm going to move the commode closer just in case. I mean, we did just give him a suppository. Um, I'm gonna let ask him how he's feeling as of now. Does he have any discomfort? Because if he does, I don't want to just leave him like that. And then I'm gonna let him know I'll be back in about 5 minutes to set him back up, and I'll do a slight reassessment. I'll reassess him over the next couple hours just to see how he's doing with all of them, and just explain if he's experiencing any of these side effects to please let me know immediately. Again, I'll make sure he knows exactly where his call light is. It'll be very close to him, and just again let him know if you have any questions. If you feel the slightest little things, just call for me and we will check you out. Um, and then I'm going to ask him if he has any questions. As long as he is okay, I'm going to step out. As I walk out, I'll do my hand hygiene and then I'm going to document everything because if you didn't document it, it didn't happen. Thanks.